Let's talk more about attention deficit hyperactivity disorder, also known as ADHD. There are some different types of treatment for ADHD. The first is behavioral therapy, which teaches strategies to improve areas of difficulty like organization, focus, and impulse control. For children with ADHD who are younger than 6 years of age, the American Academy of Pediatrics recommends parent training in behavior management as the first line of treatment, before medication is tried. For children ages 6 years and older, AAP recommends combining medication treatment with behavior therapy. A child with ADHD needs support both at home and in school. This includes behavioral management and academic accommodations. As for medications, there are several different types of medications which are FDA approved to treat ADHD in children as young as 6 years old. Stimulants are the best known and most widely used ADHD medications. Between 70 to 80% of children with ADHD have fewer ADHD symptoms when taking these fast-acting medications. Non-stimulants were approved for the treatment of ADHD in 2003. They do not work as quickly as stimulants, but their effect can last up to 24 hours. Let's talk about some of the stigma and myths surrounding ADHD. Myth 1. Accommodations give kids with ADHD an unfair advantage. Truth is that the Federal Individuals with Disabilities Education Act requires that public schools address the special needs of all children with disabilities, including those with ADHD. Special accommodations such as extra time on tests simply level the playing field so that students with ADHD can learn just as successfully as their other classmates do. Myth 2. ADHD only affects boys. Girls are actually just as likely to have ADHD as boys are. But because this myth persists, boys are still more likely to be diagnosed than girls. Myth 3. ADHD is the result of bad parenting. Well, the truth is that ADHD symptoms like blurting out or fidgeting are rooted in brain chemistry, not discipline. In fact, research shows that overly strict parenting practices can actually exacerbate ADHD symptoms. Next, myth 4. Children who take ADHD medications are more likely to abuse drugs. Studies show that having untreated ADHD increases an individual's risk of abusing drugs or alcohol. Appropriate treatment reduces this risk, and the medications used to treat ADHD have been proven safe and effective for over 50 years. Myth 5. People who have ADHD don't amount to anything. The list of high-achieving people with ADHD today includes David Neeleman, founder of JetBlue, and entertainers Justin Timberlake and Adam Levine, among others. Historical icons thought to have ADHD include Mozart, Abraham Lincoln, and so much others. As for how others can help people with ADHD, here are a few ways. 1. Be supportive and patient. 2. Don't judge and provide feedback in a positive way. 3. Give instructions slowly and one at a time, and preferably write them down. 4. When giving instructions, ask the person to repeat what they heard. 5. There are tips for parents on the cdc.gov website. And 6. Accept your friends for who they are and find their strengths. For example, students with ADHD tend to be very creative. In conclusion, ADHD is a serious disorder that affects many people. You cannot self-diagnose it just because you are easily distracted or hyperactive. You also shouldn't make jokes about having it because it's a very real struggle for many people. However, if you have ADHD, you can manage it with treatment and live to your full potential.